Health officials are worried about the cholera outbreak in Accra, which is said to be getting worse.
According to a family physician in charge of the outpatients department at the General Hospital, Dr. Agyemang-Boachie, between 6 a.m. and 1:30 p.m. when GBC 24 got to the facility, 36 cases had been recorded.
She said their main challenge is space to accommodate the patients because apart from the high number trooping in, there are referrals from other hospitals.
Since the outbreak of cholera in June, the General Hospital in Accra has recorded 743 patients. Out of this number, the hospital recorded 10 deaths. 6 patients were brought in dead. In an interview with a family physician in charge of the OPD, Dr. Agyemang-Boachie, she said the hospital's main challenge is space. This is because they have given up their emergency ward and OPD for patients, and more patients are still being brought in.
We need space to start with because there are times that they are coming, we are ready to work, but where to put a person you cannot even get. So space, and then we need a protective cover. This morning somebody just vomited on my staff and I had to rush and asking for Wellington boots and stuff to protect our heads. This dressing that you see doctor wearing, it's a bit porous. So if someone vomits, your dress gets wet. And we've had several instances like that. So the protective gear to work is also very important.
She said the hospital is treating children with cholera on their ward. However, the male patients dominate the number with the disease. Dr. Agyemang-Boachie gave advice to the public.
Cook your own food and eat. Cook your own food. If you have to buy food, make sure it is not by a gutter somewhere covered with flies. It is not cold. If you have to buy food from outside, it should be steaming hot. And then try wash your hands. Those basic sanitation measures. You wash your hands frequently. After visiting the toilet, wash your hands before you touch food. And you have to, if you cannot wash your hands because you don't have water, you can use the hand sanitizers. After you've used it, rub your hands about 6 times, then you wash. At least this will go. And then education, telling other people that this is there. Then we are aware of it. But I think on a larger scale, we should be mindful of how we dispose of our rubbish, how people dispose of the human waste. I mean, it's sad to say that in this day and age, we are still getting the disease of filth.
She was quick to add that cholera is treated simply by rehydrating the patient. Dr. Agyemang-Boachie urged other health facilities to help treat cholera patients rather than refer them to the General Hospital, which is currently overwhelmed with patients trooping in from other hospitals. To contain the outbreak of the disease, Dr. Boachie said the hospital gives preventive medication to those who bring patients to the hospital free of charge. The GBC 24 News team was also given some medication.